A new coronavirus death model, often cited by health experts, makes a sobering prediction. I'm Michael Smerconish in Philadelphia. The University of Washington's Institute for Health Metrics and Evaluation predicts over 410,000 U.S. coronavirus deaths by January 1, reaching an unprecedented 3,000 deaths a day by December. The IHME says that without government intervention, the death toll could increase to 620,000. And before you scoff at those numbers, I should point out that the IHME predictions have been fairly accurate to date, and if anything, a bit conservative. This warning comes as the president gains a new and go-to COVID advisor. Dr. Scott Atlas is a fellow at Stanford University's Hoover Institution with a background in free market healthcare and economic policy. His views are ruffling feathers, prompting headlines such as these: a new coronavirus advisor roils the White House, or Trump's COVID advisor gets a Washington welcome. Dr. Atlas joins me now to respond. Dr. Atlas, thanks so much for being here. Let's start with this. Your critics say you literally wrote the book on MRIs, that you're a brilliant neuroradiologist, but not qualified to play a leadership role in epidemiology regarding a pandemic. So what makes you qualified to advise the president in this regard?
No, thanks for having me. You know, I'm not hired to be an epidemiologist. There's a lot of things I'm not, but what I am is someone who's worked in healthcare policy for about 15 plus years with many of the best people in the world in healthcare policy. And before that, I had a 25-year career, or actually overlapping with that, in a very high-level medical science and in integrating a lot of complicated subspecialty information from high-level subspecialists in infectious disease, pediatrics, oncology, cardiovascular medicine. And so, you know, that I'm hired or asked to help here because I have a background in both medical science and healthcare policy. It has nothing to do with what I'm not. It's about what I am.
So are there parameters? Do you find yourself saying to the president, it's beyond my area of expertise?
I don't talk about stuff that I don't know, okay? I'm not one of these people that pretends to know things. What I do is I try to know as much as I can. I am a very attention to detail person. I look at the published papers with a critical eye. I've reviewed papers for 30 years in some of the best medical journals. I don't just take a bottom line conclusion. I actually read the paper. I look at the methods. If the methods are garbage, the paper shouldn't have been published. I don't care what the conclusion is. And, you know, that's a kind of healthy degree of skepticism and attention to detail that is really important these days. We have a lot of people with a lot of fancy CVs and degrees who frankly are very superficial thinkers, and that's very harmful to the discussion.
There's a portrayal of you butting heads behind closed doors with doctors Fauci and Birx and Redfield. Is that true?
Well, the answer is no, it's not true, but it's also, I can't imagine a universe where it's appropriate to talk in public about what happens in private meetings. I think if anybody did that, they ought to be ashamed of themselves. But the fact is, there's no butting of heads here. You know, we have a lot of people who know a lot, and I can tell you that I'm very impressed with the people on the task force. These are people that are working their tails off, really selflessly trying to help the president, but trying to help the country more than that, and that's what I'm doing here. And I just think these kinds of stories are really, you know, I mean, this is Washington, D.C., I'm not from here. I had no idea that news media was more interested in stirring up trouble than actually reporting fact, but that's the world we're living in now.
Well, I want to make sure I'm giving you opportunity to respond to several of the things that have been written about you recently. For example, the Washington Post, and you and I talked about this on my radio show this week, they say they've got 5 people at a senior level on the record claiming that you have been arguing for herd immunity within the White House. You told me that's a lie. Do you want to underscore that here?
Sure, it's not just a lie, it's an overt lie. It's a disgusting lie, and it's a harmful statement to make. I have never advised the president to push a herd immunity strategy. I have never told the task force that I advocated a herd immunity strategy. I've never told anyone that I've advocated a herd immunity strategy in the White House or you know, here. And, this is just, I don't know who they're talking to. I don't believe that somebody actually said that. But if they did, then that too is a lie. I mean, the news really, that's harmful because what that did, that story, it's the ultimate straw man, by the way. You put up a false statement and everybody else assumes it's true and they start talking about that. It's very harmful because it makes the public afraid. There is no strategy, zero, of just opening up the barn doors recklessly and just letting people get the infection and seeing who survives. That's really outrageous and a heinous example of bad journalism.
But you know, Dr. Atlas, where this comes from. In April, I think it was, you wrote a piece for The Hill. Presumably, that's how you ended up on the president's radar screen. The piece, when I last looked, had been shared more than 1 million times. And in it, you correct me if I'm wrong, but you seem to embrace the concept of herd immunity.
Okay, what I've done is explained that herd immunity or population immunity exists when enough people in a population, get an infection, have their own established immunity, and break the chains of connectivity of contagiousness to people, particularly the vulnerable. That's just a known fact. That's an immunological concept that if you don't understand that, you really shouldn't be advising anyone or talking on TV pretending to know if you don't understand that. That is exactly why widespread vaccines are administered, to induce immunity in enough people to stop the spread of a contagious disease. That is a basic concept. And we can see that that actually happens in certain settings. And I've said it before, and I'll say it again, that does anyone stop and think why New York City didn't have a bunch of cases come back? After the city was devastated, one of the most devastated places in the world with this infection, and then you have thousands of people protesting, yet there's no more cases. I wonder why. And the answer to why is likely, it's likely reflected in population immunity, and we can see the seroprevalence studies of their antibodies, and we double that generally, or there's more than that for T cells, and you end up having a population that probably has population immunity. But that is not the same thing as advocating that policy.
All right, I'm a layperson. I'm not a physician. I don't even play one on television. But now it sounds like you are making a case for herd immunity. We don't have a vaccine, so we haven't gotten immunity that way. You refer to it as population immunity. I'll ask it this way. Have you expressed to the president what you've just explained here?
I am not advocating a population immunity strategy at all. What I am advocating, and let me be very clear about this, is having the distancing, social mitigation factors that the CDC has outlined. I am advocating ramping up as much as possible, protecting people who have a danger from this, the vulnerable. And we are doing that. We are doubling down on that in the White House and with policies outlined by CMS to do that. I am advocating opening things, but opening safely, with mitigation, with any kind of personal protective equipment that schools or businesses need, with point-of-care testing for everywhere that needs it. I am advocating a safe strategy because we must understand something. Prolonging a lockdown is enormously harmful. This is what a public policy person does. He doesn't just sit there and say, stop COVID-19 at all costs.
Let me ask it this way. Did Sweden have the right approach?
I think Sweden did some things right and some things wrong. And I've said that before, including to you on the radio interview. Sweden killed a lot of people by being negligent in their nursing homes, for instance. 70% of deaths, the last I read in Stockholm, were in nursing homes. I mean, that's really outrageous. These are people who have a confined living situation. We ought to be able to stop that. They did some things right. They didn't lock down totally. But there are other things that they didn't do right. But, to compare them to other countries or to say that I'm advocating what they did, I'm not advocating what they did. I'm advocating what the president is doing.
The modeling that I began the segment with, do you accept it?
No. The IHME model and all these other models have been so wrong so many times. Just think about the common sense here. Why do we have to keep changing a model every 3 to 5 days, every week? The model, we're looking at the data here. Models were interesting in the beginning when we didn't know what was happening. And of course, they were proven to be wildly wrong. And I'd refer you to a review of all the models by John Ioannidis, who's a Stanford epidemiologist, world-renowned.
Yeah, I've interviewed him. I've interviewed him and respect him. But in this case, Dr. Atlas, I can put it on the screen. They seem to have been prescient. Put it up, Catherine. If anything, they've been conservative. I don't know if you can see the screen right now, but I'm going through what they said in March, in May, in June, in July. I get your point. Why do they need to continue to change the model? But when they've changed it, they seem to be spot on. You get the final word. Go ahead.
Okay, I think the model's ridiculous in many ways. When you look at what they're doing, they're claiming they can predict if you wear masks and if you don't, how many deaths will occur. That is absurd. I mean, some of these people, and we are in a country that is off the rails. Somehow we're focusing on hypothetical models. We have massive evidence here. Let's look at what we know instead of what we project in this theoretical model. I think it's really, it's really off the rails when the taxi cab driver starts knowing what a projection model is or starts telling me about hydroxychloroquine. This is sort of like the tulip bulb mania. This is really off the rails.
When I say this is my final question, this time I mean it because they're shouting in my ear. You reference masks. I just heard Dr. Fauci say, hey, it's a holiday weekend, wear a mask. I'm paraphrasing. You agree with that?
I agree with the idea that you should wear a mask when you cannot socially distance, particularly when you're near people who are high risk. That's what the president's policy is. I do not believe in a mandated or everyone wear a mask at all times. You're wearing a mask in the middle of a desert all alone. You're wearing a mask when you're driving your car all alone. We're wearing a mask when you're out in the park jogging all alone. I don't think that's either scientific nor is it rational.
How about surrounded by 1,500 people on the south lawn, outside on the south lawn of the White House, say a week ago Thursday?
Listen, here's what I think. I think the president's policy is completely right. And I also think some of these conjectures and statements trying to get people to say things like some kind of a gotcha statement, it serves no purpose. Let's focus on what we're doing, what we know, and let's not try to instill more and more fear into people. I just think that I don't know what the role of journalism is here anymore.